keeping up with the COVID topic here. Over the weekend, two leading obstetricians groups for the very first time recommended COVID-19 vaccines for all pregnant women. The American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine made the statement, citing concerns over the rising cases and the low vaccination rates. So joining us to explain is Dr. Priya Rajan. She is with the Maternal Fetal Medicine at Northwestern University. Good morning. Thanks so much for joining me. This is a united statement. These two groups had previously stopped short of endorsing the shots. They didn't say not to do it, but they just were not being endorsed. Now they are. So what do we know now that we didn't know before?
Thank you so much for having me on, Sylvia. So I think there's two big factors that have played a role in these two societies taking such a strong stance. One is that there's increasing safety data that we're seeing, that over nearly 140,000 people have been registered who are pregnant through the V-Safe registry. We're following these pregnancies through. Preliminary data from that registry suggests no increased risk in the baseline or in complications that people have talked about or would worry about, such as miscarriage, birth defects, early delivery, any of those things. And I think the other part of it is that, like we're seeing in every aspect of our lives right now, this Delta variant is a little bit of a game changer, and there is increasing risk to people now of infection. And we know that pregnant women are at a higher risk of getting severe COVID infection. They fall into that category of higher rates of complications, both for themselves and for their pregnancy.
So what do you want to say to women then who are pregnant that have not gotten the vaccine, as we have been keeping, as science has been keeping track on how safe the vaccines are in pregnant women? What have they learned about when is the best time, if any, for pregnant women to get the vaccine? First trimester, second trimester, for instance?
So there's no data to suggest that it's worse to get in any trimester. So it's fine to get at any point in the pregnancy that you are now. That is, in fact, what I've encouraged colleagues and patients to do. There is a little bit of preliminary data, I think, coming out that says the robustness of the antibody levels that are found in cord blood or breast milk may be a little higher in people who got it a little earlier in their pregnancy than those that are later. That's very, very preliminary findings, but certainly point in the right direction of suggesting that there is not danger in getting it earlier in pregnancy, and there may perhaps be benefit.
Okay, let's talk about women of childbearing age who are trying to get pregnant. Many of them worry about the possibility the vaccines, especially early on, could cause a problem for their baby they're planning on having in the future, or could cause a miscarriage. So I would love for you to address that.
Sure. There is no evidence to suggest that there is any impact of this vaccine on fertility or on miscarriage risk. There just isn't. There's no science to suggest that. And the patients that we've seen come through, we haven't seen anything about that. And also, I think the mechanisms of the vaccines are such that they clear the system within 10 to 20 days.
Mm-hmm. Okay, so let's talk about the alternative, which some are choosing because they want to protect their unborn child. What's the alternative of not getting the vaccine and then coming down with COVID while you're pregnant?
So the alternative is taking a big chance. Honestly, we have seen pregnant women with COVID. They have higher rates of admission to the ICU, of needing oxygen and ventilatory support, of needing this intervention that's called ECMO, which basically is something you have to turn to when your lungs have fully stopped functioning. They also have higher rates of needing to be delivered early. I can definitely tell you of cases of patients that we have had to deliver prematurely because of the mom's worsening status. And then to top it all off, those moms are separated from their babies because they are in the ICU. The baby is in the neonatal ICU. And even when they're doing better, there's a period of time where they may need to be separated just because of the mom's infectious status. So there's a lot of downstream effects potentially of getting a COVID infection for both you and this baby.
Well, Dr. Priya Rajan, really important topic. I know a lot of women are listening to what you're saying this morning because I've talked to so many who've made the decision not to get vaccinated for fear that it might affect their unborn child. So important message, and I do appreciate you joining me this morning with that.
Absolutely. I tell patients often that some of the things that I have the most scientific evidence to support in pregnancy is the use of vaccines. That is, of all the recommendations we give, we have a lot of good data to support that is the best thing for these moms to do. Thank you so much for having me on to be able to talk about this.
Yeah, we appreciate your time. We'll be right back.